If your morning strength is gone, don't reflexively reach for a blue pill. Try this first. I'm Dr. Camila Vega, a urologist who has worked with hundreds of older men over the past 2 decades. I've sat with men who assumed nothing could be done, and I've watched others recover a sense of physical confidence, not always perfectly, but often meaningfully. Losing morning erections is more than an embarrassing inconvenience. It's a signal, a symptom that tells you something about blood flow, nerve signaling, habit wiring, and even emotional connection with your body. Before you make that reflexive phone call for a prescription, let me show you why a different first step can be safer, easier, and for many men, more effective in the long run. If this message is speaking to you, subscribe and hit the bell so you don't miss the follow-up, where I answer common questions and walk through variations of this plan. Morning erections are not vanity, they're maintenance. They're your body's way of lubricating, oxygenating, and exercising penile tissue and keeping the nerves and blood vessels healthy. When they disappear, it's often a sign of wear in one or more systems: vascular, neurological, hormonal, or behavioral. The good news is that in many cases the situation is modifiable. The wrong approaches, though, can make the problem worse. Over the next minutes, I want to walk you through the 3 mistakes I see most often, each illustrated by a patient story, and then give you a practical, safe protocol you can try at home, 10 minutes a day for 30 days. It's called the Reconnection Protocol. It's simple, low risk, and designed to retrain the nervous system and care for tissue, not to replace medical evaluation when that's needed. The first common mistake is something many men do every day without realizing its long-term cost: automatic mechanical masturbation with high-speed, narrow stimulus technique. We live in an era of immediate gratification and high-intensity visual stimulation. Pair that with a repetitive mechanical routine, and you create a learned response in the nervous system. The brain begins to associate sexual arousal and orgasm with a very specific pattern, a particular grip, speed, angle, duration, or visual cue. Over time, that conditioning can narrow the range of stimuli that reliably produce an erection or orgasm. In technical terms, this is conditioning and desensitization. The dopamine-driven reward loop adapts, requiring greater intensity or novelty to trigger the same response. For some men, that shows up as delayed orgasm, difficulty responding to a partner, or needing increasingly extreme stimuli to reach climax. For others, it can look like reduced morning tumescence or erectile rigidity. I'll give you a concise example. Don Hector is 67. He came to see me embarrassed and frustrated. For decades, he had developed a quick, efficient routine at home. 10 minutes, same chair, same visual material, same hand motion. It worked. Then, after his wife passed, he found himself relying on that routine more often. Months later, he noticed that in bed with a partner, his response was different. It took much more time, and sometimes he couldn't get a full erection. He'd wake up and notice the morning firmness was fading. When we talked, it became clear his brain had learned to expect a narrow, high-intensity pathway to sexual reward. That's subtle and very common. Importantly, it doesn't mean he was morally wrong or weak. It means his nervous system had adapted. With targeted behavioral work, many men like Don Hector can broaden their sexual responsiveness again. It takes time and deliberate practice, not shame. Many-hook. Number 1 mistake is something you probably do almost automatically, and it's rewiring your response. The second mistake is the opposite: complete avoidance of sexual activity and ejaculation for long periods. This often happens after loss, illness, or simply the belief that sexuality expires with age. Men tell me, "I don't need it anymore," or "What's the point?" and they stop engaging. No partnered intimacy, no masturbation, no sexual touch. Physiologically, infrequent ejaculation can contribute to prostate congestion for some men, pelvic discomfort, and altered urinary symptoms. The prostate produces and clears fluid. Periods of prolonged stagnation can lead to inflammation and bothersome urinary frequency or nocturia for certain individuals. There is epidemiological research that suggests relationships between sexual activity patterns and prostate health, but the details are complex and not uniform for every man. The practical takeaway is simple. Regular, comfortable sexual activity, whether with a partner or through masturbation, can be one component of prostate and pelvic health for many men. Many-hook. A surprising cause of nighttime bathroom trips? It might be that you're not ejaculating at all. The third mistake is emotional: shame and disconnection. Shame is quietly corrosive. It triggers stress pathways, raises cortisol, reduces testosterone signaling, and narrows emotional and physical engagement with yourself and others. Over time, that hormonal and psychological cascade can reduce libido, diminish spontaneous erections, and impair overall vitality. Men who feel shamed about their bodies or sexual function withdraw. The less they touch, talk, or connect, the more the body and brain downregulate sexual systems. This creates a feedback loop that feeds low mood and, in some cases, cognitive fog. Don Luis came in complaining of low mood, fatigue, and a faded interest in life. He was 72 and had isolated after a series of losses. He thought his sexual life was over and felt ashamed to even talk about it. We started a reconnection plan not focused on performance, but simply on bodily presence, breath, gentle touch, regular movement. Over weeks, he reported better sleep, improved mood, and a gradual return of morning firmness. Don Javier, 73, had low testosterone on lab tests and also noted he rarely engaged sexually. With a combined approach, lifestyle changes, behavioral reconnection, and a careful endocrinology evaluation, he regained energy and interest. Not every man will need hormones, but disconnection and shame are powerful downregulators of sexual and hormonal health. Reconnection addresses the body and the mind together. Mini hook. Shame doesn't just hurt your feelings, it can lower hormones and shrink your sense of vitality. So how do you respond to these pitfalls? The Reconnection Protocol is a practical, low-risk program you can try before making a reflexive decision to start medication. It's a behavioral first step that supports tissue health, retrains conditioned responses, and rebuilds emotional comfort with your body. I'll give you the step-by-step, but remember, this is not a replacement for medical care. If you have sudden loss of function, severe pain, blood in urine or semen, or known significant heart disease, talk to your doctor before initiating new practices. If you're on medications that interact with sexual function, consult your physician before making changes. The protocol is simple: 10 minutes a day, private space, slow intent, breath, and curiosity. Try this every day for 30 days and keep notes on what changes. Step 1. Find a private, comfortable place and time. This could be a chair, a bed, or a sofa, somewhere you won't be interrupted and where you feel safe. Tell yourself you're giving your body attention, not performance. The goal is reconnection, not orgasm. Step 2. Set a timer for 10 minutes. Commit to the full period. Short, consistent practice beats long, sporadic sessions. Step 3. Begin with breathing. Sit or lie comfortably. Take 5 slow, deep breaths in through the nose and out through the mouth. Each breath should be deliberate. Inhale for 4 counts. Exhale for 6 if that feels natural. The breathing calms your nervous system and prepares you for mindful attention. Step 4. Soften. Scan your body from head to toe, noticing tension points, jaw, neck, shoulders, pelvic floor. Consciously relax those areas. Let the pelvis be soft. This is not performance, it's body care. Step 5. Begin slow, intentional touch. Use your hands to explore slowly and gently the area around your genitalia, lower abdomen, inner thighs, perineum, and so on, anywhere you feel comfort. The key is non-goal-directed contact. Move slowly. Change pressure, texture, and rhythm. The point is to expand sensory maps in the brain. Think of it as sensory retraining. Step 6. If sexual arousal rises, allow it to be observed without shame. Notice sensations, maintain relaxed breathing. If you feel the urge to ejaculate, you can allow it or not. Both are acceptable. The protocol emphasizes removing orgasm as the endpoint of significance. Practice the idea that pleasure and connection are valuable without being exclusively tied to orgasm. Step 7. When the timer ends, take 2 more slow breaths and note 1 observation. Did anything feel different today than yesterday? Small wins matter. A bit more comfort, a new area of sensation, or slightly longer-lasting tumescence. Record it in a notebook or a notes app. Tracking progress helps maintain motivation. Practice daily for 30 days. Most men will not see overnight reversals. This is a retraining process. What you are aiming for is gradual expansion of sensory responsiveness, a reduction in conditioned, narrow trigger patterns, and better tissue health through more regular blood flow and neural signaling. Why does this work? 3 short explanations. First, neuroplasticity. The adult brain can and does change with repeated practice. By introducing varied, non-goal touch, you encourage the nervous system to widen the range of stimuli that produce arousal and to reduce dependence on a narrow, intense pattern. Second, vascular maintenance. Regular blood flow and periodic tumescence help oxygenate erectile tissue and preserve vessel health. Think of erections as regular oil changes for a working machine. They're part of routine maintenance.
Third, hormonal and psychological benefits. Regular sexual expression and reduced shame help support mood and may positively influence testosterone signaling indirectly through lower chronic stress. This protocol pairs well with a few adjuncts that many men will find helpful. First, consider limiting high-intensity pornography. That doesn't mean moralizing your choices. It means recognizing that intense visual novelty can condition the brain. A graded approach often works best. Reduce frequency, try a 30-day break, or restrict to a few set times a week. Many men see meaningful improvements with reduced high-intensity visual stimulation. Second, address cardiovascular health. Erectile function is a barometer of vascular health.
Control blood pressure, manage cholesterol, stop smoking, and maintain a healthy weight. These are all core to long-term sexual function and to overall health. If you're already on medications for blood pressure or heart disease, consult your physician before changing anything. Third, rebuild general strength and sleep. Resistance exercise, even light weight training a few times a week, improves testosterone signaling and vascular function. Adequate sleep supports hormone regulation and mood. Small lifestyle steps compound. When should you seek medical care? See your clinician promptly if you have sudden onset erectile dysfunction, severe pelvic pain, blood in urine or semen, or new cardiac symptoms with sexual activity, chest pain, shortness of breath, fainting. Also seek assessment if you have persistent urinary bother, a rapidly rising pattern of decline, or if you're unsure about the safety of exercise or sexual activity because of heart disease or medications. And a quick but important note, do not stop or start prescription medications, including testosterone or erectile medications, without your physician's guidance. These medications can interact with other drugs and underlying conditions. Where do medications fit in? PDE5 inhibitors, the blue pills, are a legitimate, evidence-based tool for many men. They improve blood flow and can be life-changing, particularly when vascular disease is the main issue. My point is not to demonize them, but to argue against reflexive, exclusive reliance on them without addressing behavior, mental health, and lifestyle. For some men, behavioral work alone is sufficient or makes medications more effective when used together. For others, combined strategies deliver the best outcomes. The right path is individualized. If after a trial of behavioral reconnection and addressing basics, you still have significant function problems, medications, further testing, or referral to a specialist are reasonable next steps. Let me be clear, this protocol is not a guarantee. I don't promise universal restoration. What I am offering is a structured, evidence-aligned behavioral approach that can often improve responsiveness, reduce shame, and support tissue and hormonal health. Many of my patients have improved with this kind of practice, and some require additional medical therapies. The ethical approach is to try a low-risk behavioral step first, document how you feel, and then partner with your clinician for further options. Practical tips to get started and stick with it. Pick a time of day you can consistently keep. Many men find morning or right before bed helpful. Keep a small journal and write one line each day. 10 minutes done, noted X. That's it. If privacy is an issue at home, find a time when interruptions are least likely. If past trauma or severe shame makes touch distressing, consider a counselor or therapist trained in sexual health. Reconnection can be guided safely with professional support. If you experience pain or bleeding during any practice, stop and seek medical evaluation. Some common questions I get in clinic: what if I don't want to masturbate? That's okay. The protocol emphasizes touch and presence, not compulsory masturbation. Could daily practice make things worse? Unlikely when done gently. If you feel increased pain or sharp discomfort, stop and consult a clinician. How soon can I expect results? Some men notice small changes in days to weeks. For most, a 30-day gives a reasonable test of progress. Keep expectations realistic and celebrate small improvements. A final practical consideration: prostate health and ejaculation frequency are complex and individualized. There are studies suggesting associations between ejaculation frequency and prostate outcomes, but those findings are not prescriptive for every man. If you have a history of prostate cancer or are at high risk, discuss sexual activity frequency with your oncology or urology team. Don't rely on generalizations. Let me close with a few Schwitz stories to hold this in human terms. Don Ekdor expanded his sensory map through slow, intentional practice and gradually reported better response in partnered intimacy. Don Roberto's pelvic symptoms improved when he reintroduced gentle sexual activity and pelvic movement. Don Luis reclaimed energy and mood after working on body connection and sleep hygiene. Don Javier used behavioral reconnection alongside a careful medical evaluation to restore energy without rushing to hormonal therapy. None of these are universal templates. They're individual paths that illustrate a principle. Small, consistent, low-risk practices can shift the trajectory. You do not have to accept loss as inevitable. Aging changes bodies, yes, but change is different from end. Reinforcement of nervous system patterns, attention to vascular and hormonal health, and, critically, permission to touch and know your own body again are powerful. Before you reach automatically for a blue pill, try a month of intentional reconnection. If you see progress, great. If not, you will have better information to take back to your doctor about what changed and what didn't. Remember, this is general information and not medical advice. If you have sudden symptoms, severe pain, blood, or a history of heart disease, talk to your doctor before changing your routine or medications. If this video resonated, leave a comment saying yes, and tell me one question you want answered next. Do you want a deeper walkthrough of the breathing and Petch technique, or a guide to integrating this with medical therapies? Subscribe for more evidence-based men's health content, and share this with an older man you care about if you think it could help him. Reclaiming a measure of sexual self is possible at any age with patience, practice, and the right medical partnership.